the last speaker for the first session, Dave MacCutcheon. Sorry,
You did.
my not.
You got it right on the first try. It's McCutcheon. Thank you.
Okay, perfect. And he is the COO of InfoBionic, and he will be speaking about modular approach to diagnostic ECG wearables. The floor is yours.
Thank you. Thank you for inviting me, and thank you all for attending this morning. Appreciate the opportunity. So, what I want to do first is set the stage a little bit about ECG wearables and what I'm going to talk about. Um, so, ECG electrocardiography has two real markets or two methodologies today. And the gold standard for diagnostics is the medical version of ECG. And so essentially that is collecting up the electrical tiny signals that come from your heart as the heart muscle depolarizes. And this energy passes out to your skin in various vectors away from the heart. And then our monitors can pick those up using what are called electrodes. And you've probably all either seen that, and that's why I have the little picture of the waveform when you see either on a medical show or you've been to the doctor and they put you on the ECG. And each of those little waves represents a vector of the electricity coming off your heart. Now, there's another technology that's out there that's used mostly for off the shelf, or we'll call consumer goods. And this is a photoplethysmograph, the PPG. It's really great for heart rate trackers, gets your heart beats. It actually uses the change of the blood volume in your cardiovascular system and the small skin vessels to actually do the heartbeat, count it. It's been proven to be very accurate for heart rate tracking, for heart rate variability, and actually has some applicability for limited arrhythmia detection for atrial fibrillation. But today's focus will really be on ECG, the medical devices, the prescription devices. So kind of what we're doing and what we're doing a little bit different. I think to roll back a little bit to talk about the history of ECG is that when I talk about the monitor that we're going to be talking about that you wear, a prescription monitor for ECG, a lot of people refer to those as Holter monitors. And the Holter was actually invented in 1947. So that's the image on the far left, or I guess you're right. I'm trying to figure out how that works. On your left, that's Dr. Holter trying, which actually was an electroencephalogram and electrocardiogram all in one in 1947. If we look at the picture on the right, that's a pretty typical Holter monitor from the era from about 1970 up through about 1999. And then in many cases, these types of Holter monitors remained prevalent as an initial diagnostic tool until about 2010. And even in some cases, they're still used. This specific device type is still used around the world. But this is kind of the etiology of it. If we look at what's really happening today, and I'm going to say current state of the market, and I'll clarify, this is really US market focused here. And that's because there is a different delivery method and approach for the way that the US healthcare system and the way electrophysiologists and cardiologists order and prescribe the device in the US, which is slightly different than the models used throughout Europe and the rest of the world. When we get into talking about the types of exams a little bit, which is beyond just the Holter monitor, which is the mobile cardiac telemetry devices, those are relatively expensive in both the devices and the need to monitor the patient in real time or near real time for 30 consecutive days. What we're seeing in the market, and you see the picture here, and it looks like a lot of patches. What's happened is the U.S. market has shifted toward this, what we call a one lead patch strategy. Most of the larger companies have developed these. Most of them are non-communicating, meaning that the patient sticks this patch onto their body. Either it's mailed to them or they get it at the office, and then they mail it back, at which point someone is reading the data off of it and generating a report. There are some of these that are communicating, but what we generally find is that in the market is that most of these are